Welcome to the Medicare Show. I'm your host and Medicare advisor, Jeffrey Kuhn. On this podcast, I'm going to be reviewing United Healthcare's Medicare Advantage plans, the AARP Medicare Advantage from United, New York-0025 PPO, which is a preferred provider organization. And this plan's been around for a couple of years. They've come out with this kind of, I won't say replacing the other PPO they've had, but the other PPO got a little more expensive, and the benefits, believe it or not, weren't quite as good as this one. So I'm going to go through and do a quick summary of the annual notice of change and some of the changes with this for 2025. And if you do have United Healthcare, this is one of the plans, if you have it, you want to really pay special attention to. And you'll pick up pretty quickly and pretty easily why. But when we look at the plan, I'm going to flip through. So if you have this plan and you have your annual notice of change, you want to start with page number 8. And like all annual notices of change, they start out with a summary of important costs for 2025. And what they take a look at is the things that typically people pay the closest attention to. And some of them, for a lot of people, are the most important things. And here's some examples. The monthly plan premium in this plan in 24 is $19. And the plan is going to increase the premium to $35 for next year. They have a maximum out of pocket for all Medicare A and B related covered services in the plan of $7,550. And that's for in-network. Out-of-network, it's $13,000. And the PPO plans, keep in mind, they do have out-of-network coverage. In 2025, they're going to increase it to $8,900 from $7,550. And should you be out-of-network, it will be $14,000. Doctor office copays. That's what typically most people use. This year, there's no copay for your primary. Next year, there's no copay as well. Keep in mind, all your preventative is still covered, your physicals, colonoscopies, and mammograms, things of that nature. And you will pay $58 copayment if you're out of network, and that's going to stay the same for next year for your primary. Now, specialist visits, $40 copayment, and it's going to stay the same at $40 for next year. However, they are going to change the out-of-network copay. So this year it's $65. Next year it's going to go up to $80. Now, in the event you are inpatient in the hospital, and this is something that typically doesn't happen with most clients, it's typically outpatient or ambulatory or observation stays. But inpatient hospital stays, you will be subject to copay for the first 5 days. This year it is $375, and it's going to stay the same at $375 for 2025. So just keep that in mind. The important ones, again, the things you want to look at are the outpatient. Those are the things where most people are subject to copays and things around. But if you go through, you'll find some additional information on the drug coverage as you go through the pages on this, and that's where you want to really look at. In page 9, they start with the deductibles. So the prescription drug coverage is going to work a little bit different. So what you've got is a $525 deductible. Actually, they got that listed as a copay. Let's go back and double check this. I know these pages and the drug coverage can be a little bit confusing. Okay, now that I have the right pages in front of me, we're going to start that whole prescription drug coverage thing over again. So for this particular plan, like some of the others, the nice thing is you'll be paying co-pays for your tier 1s and tier 2s. There are no deductibles for those. You are going to get a deductible for your tier 3 and higher. You pay that deductible once for the total calendar year. But this year, there's no copay on your tier 1s and 2s, and they're going to keep that the same next year, no copay. The deductible, however, has changed a little bit. The deductible this year was $195 for tier 3s, 4s, and 5s, except obviously covered insulin and vaccines. Next year, the deductible is going to be $570. That's a pretty big increase. Tier 3, Tier 4, and Tier 5s are subject to that. So that's something that is worth noting. That in of itself in the premium increase would give cause to maybe think it's time to give me a call, and we can help maybe shop around a little bit for a plan that might work better. So that is a little expensive. Your Tier 3 copays, there's a $47 copay on those, and it looks like that's going to stay the same for next year, which is good. So that in of itself, at least the copays are the same, but the deductible seems a little bit high to me. Let's take a look down and see what we have for Tier 4s. Tier 4, $100 copay this year. It's going to be a $100 copay next year. And then Tier 5s are going from 30% coinsurance up or down to actually 26% coinsurance for next year. So that's going to go down. Keep in mind your out-of-pocket max is $2,000 for next year. So even though you have that deductible, if you're in this situation where you've got really expensive drugs, it's really not going to matter, because when you divide under a payment plan, you're still going to have the $167 a month, even though the deductible went up. You're just more likely to hit your $2,000 out-of-pocket max. So keep that in mind when you're looking at those. Now, they do offer a dental rider in this plan. So the Platinum Dental Rider, and this is where it's really important to know that your benefits are going to vary. You've got to make sure your doctor really is in their network. If the doctor says, oh, we take it, the dentist, or we'll bill it, your reimbursement rate is going to be a fraction of your benefit. But for $50 a month this year, you got a $1,500 per year covered preventative and comprehensive dental services. Next year, it's going to be $54 a month for that $1,500 benefit. So you got to really evaluate with the premiums you pay in for the year. Are you getting the value out of the rider or not? So it does say you can receive dental services from an out-of-network dentist. If an out-of-network dentist charges more than your plan pays, you're going to be billed for the difference, even for services listed as a $0 copayment. So please keep that in mind. I usually tell folks with dental, just be careful. Not a lot of dentists take it. So you want to be careful with that, because a lot of people have the expectation that they're going to get a full $1,500, and that's not necessarily the case. So keep an eye on your annual notice of change. Again, it's really important this year to take a look at these. There's a lot of changes happening. There's plans that are being terminated, and if you don't pay attention to this, you could find yourself January without any coverage other than original Medicare. So hopefully you found this podcast helpful. Please share it, subscribe to it, and we look forward to bringing you additional information here in the future. Take care. Bye-bye.